Tonight we're learning more about Virginia's Marcus alert system and how it's being implemented here in our region.
Yeah, Marcus David Peters was killed by Richmond police in 2018 after he allegedly charged an officer while experiencing a behavioral health crisis. Last year, the Virginia General Assembly passed the Marcus David Peters Act, which allows people to call 988 instead of 911 to have behavioral health specialists respond.
Well, News Channel 11's Bianca Murray reports on how the system is being rolled out here.
A call centre has already been set up through Frontier Health for clinicians to help local law enforcement during behavioural health crises.
The Marcus Alert is intended to be an opportunity to create a behavioural health response for a behavioural health emergency.
Dialing 988 when you or someone else is experiencing a crisis instead of dialing 911.
The intent of 988 is to be the behavioral health equivalent of 911. It will land at these call centers as opposed to with 911. But the call centers and the 911 dispatchers will work hand in hand and will transfer calls back and forth as deemed appropriate.
55 people in Washington County, including mental health experts, law enforcement, minority leaders, and more, contributed to the co-response concept of a mental health professional joining a Washington County deputy on these calls.
For example, in Virginia Beach, they could have a backup officer there in just a minute if a clinician needed anything. Here, it would take a little bit longer. So the thought process was if you put the clinician with the officer, in this case the deputy, then they'd be able to respond really quickly.
But why is this necessary?
You know, jail is the thing that we want to avoid. The additional piece that we want to avoid is unnecessary hospitalization. And we want to try and intervene early and get the right supports and the right level of supports wrapped around the individual to try and prevent further escalation into any of those additional systems.
An inpatient facility is under construction in Abingdon and will be completed in coming weeks.
We're able to just give them a soothing environment where they can further de-escalate away from the stress and chaos that might be in their home environment that's helped contributing to a crisis situation.
The 988 line is already available in our area, with 911 dispatch relaying behavioral health calls to the appropriate people. In Abingdon, Bianca Murray, News Channel 11.
All community service boards in Virginia will be required to adopt the Marcus Alert program by July 1st, 2026. The nationwide 988 hotline set to launch by 1st of July this year, and local authorities say that will help with Marcus Alerts in Virginia.